Sorry, let me just do this.
Hi everyone, my name is Shabir Musa. I see that we have got quite a few attendees. Welcome. We've got about 30 people. It's growing to 32. My name is Shabir Musa. I am a family physician in Johannesburg. This is a CPD meeting for the Johannesburg Health District. We're really pleased to have you here. We have a very exciting program that has come by virtue of ICAS. And we really hope that we can provide you a good morning. I just want to get something quickly up that will help me. So I think in terms of process, what we are looking to do is to go through your approach. So give me a second. We basically want to go through an approach in which you can understand COVID-19 and be able to look at mental health related issues, particularly your mental health, I imagine, and to use this as a platform for you to talk a little bit about what's troubling you and perhaps coping strategies. We hope that you'll also enjoy a half hour that will enable you after the 1 hour session is over to be able to look at a new concept that we're looking at and that members of the team that is with us today will be able to share with you. So just in brief, I've got on the call Dr. Vanessa Govender from Masakhane, Strategic Health Consulting, and Ms. Navlika, who's from ICAS, that will also be part of this discussion. And we're really grateful in having Baiju Dharmalingam, who's also going to be part of the session in dealing with the half hour. In terms of you being able to engage with this platform, I suggest strongly that you look at the Q&A and the chat at the bottom. Please feel free to add your comments in the chat, but please keep your questions to the Q&A. It'll make it much easier for us to handle. So I want to hand over to Dr. Vanessa Govender. Vanessa, perhaps I can just unmute you. And unfortunately, I will have to leave. So I'm going to leave Vanessa to continue with the entire session. So she's going to manage this completely. Before I start, just very quickly, while Vanessa is talking, you have an opportunity to fill in who you are and where you're from in Johannesburg or beyond. So please use that opportunity to tell us where you're coming from. In the meantime, I think I'll hand it over to Navlika, to Vanessa to introduce the team more in detail and to spell out the session. Vanessa, thank you very much for doing this, and over to you.
Okay, thank you. Good morning, Prof. And thank you to all our attendees who are online. A very warm welcome to you. This is the session, a CPD session for the Johannesburg Department of Family Medicine. And the webinar CPD topic today is COVID-19 and occupational stress. So I just want to get onto the presentation. To share my screen, please bear with me. All right. Do we all see that well? Thank you. So this CPD session has been put together really after a conversation started with a couple of colleagues with ICAS, with Prof. Shabir at Wonka Africa. And at the outset, I'd like to thank Prof. Shabir for his amazing leadership and his compassion and really his expertise that he's brought through to this partnership to put the sessions together. And over the last 3 weeks since the lockdown, we have had debriefing sessions every morning, supported by ICAS, and we thank them as well for coming forth to this partnership, where we offered the webinar debrief sessions for healthcare workers like yourselves. I'm sure some of you even called in. And this morning is really a culmination of those debrief sessions. And what we want to do is to just share with you some information on how you can seek assistance for mental health, psychosocial support. These are unprecedented times, and it really calls for innovative and unprecedented strategies in coping as healthcare workers on the front lines. And today we really want you to leave with, with some tools and some techniques to build that resilience and to really support you while you're on the front line and on the job. So the program looks like this. We'll go into just a bit on occupational stress in primary healthcare workers, and I will manage that. After that, Ms. Navlika Ratangi from ICAS will talk about looking after your mental health in times of crises. We'll have plenty of time for questions and answers, and we'll manage that through the chat boxes, or you can present it to the panelists. And lastly,
Vanessa, sorry,
yes.
Vanessa, I think people have requested you to put it on slide view. They can't see the detail. If you just put it on slide view, I think that'll be useful. Thanks.
All right. Is that better? Okay. So yes, and at the end of the session, we'll have 20 minutes. We'll enter into a nice breathing zone where we will learn these techniques that we can use on the job. So, Prof. Shabir, shall I go ahead, or you want to add some inputs before I go into the slides?
No, I'm done. I think you can continue. Thank you.
All right, thank you. So this is a study that was done on mental health workers in China, and it's very recent, as you can see, and it was conducted between the 29th to the 3rd of Feb. And there were 1,200 healthcare workers who were participating in the survey at 34 hospitals. And this was at a time where there were more than 10,000 COVID-19 patients in Wuhan and in the greater Hubei province. And what they found that frontline workers who care directly for COVID-19 patients reported much higher levels of severe mental health symptoms than those who were in secondary roles. And when they did adjusted analyses, they found that women were more significantly likely than men to report symptoms of depression, anxiety, and psychological distress. So I think what's important is, at the front end, we understand that there's a whole host of factors that contribute to our psychological distress. And the study found that emotional strain, physical exhaustion, when you have to care for growing numbers of very acutely ill patients of all ages and who had the potential to deteriorate rapidly, really put significant stress on our frontliners. Caring for co-workers who may be critically ill themselves and who might sometimes succumb to COVID-19. The shortages of personal protective equipment has been very topical in our circles recently. And this really intensifies our fears of the COVID-19 virus. The concerns about our own family members. We go home from the workplace with feelings of being potentially contaminated ourselves, and we have members of the family at home who are older, probably immunocompromised from diabetes or cancers, and we have little children, pregnant women, and also the chronically ill at home. And this is a huge concern. And this actually came through on some of the debrief sessions as issues that were bothering our healthcare workers. The shortages of medical equipment, it's always at the back of our minds that we will not have sufficient equipment and that our systems would be rapidly overwhelmed by the numbers of critically ill patients. And of course, this anxiety about assuming new or unfamiliar clinical roles with an unfamiliar disease. I mean, this takes us back to the time of HIV, where we had a disease where we knew very little of, and there was no treatment for it. And the expanded workloads that we see in these settings can be really overwhelming. Overall, in this study, they also found that there was limited access to mental health services for managing depression, anxiety, and general psychological distress. And I think that's what this workshop is aiming to do, is to provide you with the information on how you can access mental health services. And at the end, there's slides with some hotline numbers. But what I think more importantly for today's session is that we leave you with some coping techniques and strategies that you can use at the workplace. So the inevitable is that occupational stress and burnout is going to happen. In the best of times, in the pre-COVID times, we were already experiencing stress and burnout. So how do we get into the workspace and face this monster that's upon us with the strength and with the resilience and courage and really the support of each other? Because I think at the end of the day, it's going to be that the peer support you get and the support you get from professional structures like ICAS and many other institutions that have really come to the fore to support our healthcare workers at these times. This is just a note to say, last year, the World Health Organization for the first time declared burnout as an occupational phenomenon. And it's a syndrome that results from chronic workplace stress that has not been successfully managed. And that's what this workshop is about, to try and manage what we know is already there, and it's only going to intensify as the pandemic spreads and the waves of the epidemic spreads in South Africa. We want to avoid the situation of overwhelming stress and burnout. So at that point, I'd like to hand over to Navlika. Is our audience and everyone still good? I will now stop my video and my screen. And thank you. I shall introduce you to Ms. Navlika Ratanji. So Navlika is the Clinical Operations Director at ICAS, and she's a Gibbs MBA graduate and a clinical psychologist with diverse experience in human capital management, behavioral risk, change management, global management consulting, leadership, and organizational resilience. She has an abundance of experience in dealing with mental health in the workplace and has consulted to many South African corporates in this regard. So I'd love to welcome Navlika to our virtual podium and platform. And at this point, I also really want to extend our gratitude to ICAS for supporting this initiative and for really walking this journey with us. And over to you, Navlika.
Thanks so much, Vanessa, and a very good morning to everyone who's joined for the CPD talk. So my role this morning is really to talk about looking after your own mental health at this point in time where we find ourselves in the COVID-19 pandemic. I do have quite a lot of information on the slides, but we'll make the slides available to you afterwards. And so as a result, I'll just touch on some of the key points that I'd like to bring up for discussion today. So I think the first thing to acknowledge is firstly that infectious disease outbreaks like COVID-19 can be scary and can certainly affect our mental health. At present, we see levels of 1 in every 4 individuals will struggle with a mental illness at some point in their lives. And global trends suggest that that figure will change to 1 in 2 people that will struggle with a mental illness at some point in their lives. Vanessa already covered the fact that as healthcare workers, that category of people is primarily at risk in terms of all the anxieties that they are being faced with and challenges that they are being faced with, resulting in an increase in mental health issues. So it's pertinent to talk about this topic and raise awareness around looking after your mental health. There are many things to be fearful about. Things like your risk of exposure, fears of your loved ones being exposed or even getting ill, an increase in the panic, and this results in completely increased anxiety levels as well. The lack of protective equipment, as Vanessa mentioned, all of these factors result in raised anxiety levels. So I think it's important to also understand that it's natural to feel overwhelmed and vulnerable at a time like this, and that it can be further complicated if we have any pre-existing trauma sort of conditions or pre-existing mental health issues. That may put us in an even more vulnerable category to the effects of COVID-19 and to further mental health issues. So what might be helpful is to anticipate an increase in your levels of discomfort at a time like this and your own feelings of anxiety and distress, and to acknowledge how you are feeling and to remind yourself to take care of one another and yourself in these difficult times. And we'll go through a few frameworks today in terms of just refocusing and reframing these challenging times. One of the things to gain perspective on is that we are in a time and a period of disruption right now. And that disruption looks different to different people. For some, it's the fact that they are on the front line. For others, it's the fact that they have children at home that needs homeschooling. For others, it may be saving your business and partners that may be impacted from the COVID-19 pandemic. So there's multiple reasons to feel overwhelmed at this point, and there's multiple reasons why we consider this a period of disruption. But we also need to recognize that there was a period before this disruption and that there will be a period after this disruption. And to separate those phases into very disparate contexts is useful to be able to look at this as an opportunity to build life skills and to build problem-solving skills. So that we are mindful of the fact that this period will eventually pass, but that life will look different in the period after this. And how do we start to build the relevant life skills for that period? So in dealing with anxieties that have negative mental health effects, just a few things to remind yourself of. It's important to stay connected, especially if you are living alone. But again, as being a healthcare worker, it's important to stay connected to your support systems. Because even though you are not able to socialize and mix with those support systems at this point in time, we have the wonderful use of technology to still stay connected to our support systems. Misinformation raises anxiety, and being in the healthcare worker space, you probably have more access to reliable sources of information, but you may also be experiencing a different set of misinformation around resources that are available to you, equipment that is available to you, how this gets distributed, and all of those kinds of things. So there may also be an overflow of information, and it's important to recognize what do you need to switch off from that, and what may be impacting on you in terms of your own mental health, so that you know when you need to switch off from that. And simple things like turning off your WhatsApp notifications, because there's just an overflow of information coming through on WhatsApp and our social media, unfollowing certain negative social media at this point in time, just to give yourself that space to switch off from everything that's going on around you. You obviously need to do what you can to protect yourself proactively, but that we also can't be caught being completely preoccupied with this. And that despite our best efforts to look after ourselves and protect ourselves proactively, the fact is we may still be exposed to COVID-19 and be impacted by COVID-19. And so for this reason, we need to ensure that we also planning adequately for this eventuality, and that this will help you and your family feel more prepared. So know who to phone, where to go. Does your family know who to phone? And who do they turn to? What basic medication is available on hand? What childcare arrangements do you need to put in place if you were exposed to COVID-19? And what does isolation require of you practically? These are things to go through and to talk about as a family, so that you do feel more prepared in that eventuality, which of course has a positive impact on dealing with it at the time and on our mental health at the time. So talking about it, developing those communication strategies and things you would need to do to get through this time is critical. We also need to look at developing a flexible mindset. And we already know that the lockdown has been extended, and there's a possibility that it may be extended even further. And what do we need to do to open our minds to the idea that it may be longer? And even once the lockdown gets lifted, that it will be lifted in stages, so it will still have a lasting impact on many of us and our family members during this time. So it's important for our family to stay productive and for ourselves to stay productive even when we're not on the front line. So yes, we need to take rest, but we also need to keep ourselves active in that time. We do need structure for the day, and especially since you are leaving home to be in the front line, what does that structure look like for your family members? Structure for your children, and trying to get a new rhythm to get through the day. It may not be possible for you to work in small chunks, given your roles, but I left that particular coping strategy in there because it may be useful to remind your family members to still to try and find that new rhythm and work in small chunks of, they say, between 60 to 90 minutes at a time, and then take a break, spend some time with the kids, if there are children in the home, or make a meal or whatever it might be, but take a break and then continue. Otherwise it feels like you're working the whole day. So having a discussion with the family around how these structures need to look like, how you break down the day, what ground rules need to be put in place, and how we're helping each other out in a time like this. And when you need to spend time on your own, and when you need to spend time as a family, building the community and support with each other, are all things that need to be talked about openly, so everybody understands the role that they need to play and how they're contributing to looking after each other's mental health at a time like this. Eating well and continuing to move is obviously also important for your immune system at this point in time. So if we just turn the lens specifically on looking at being a healthcare worker in the age of COVID-19, Firstly, a massive thank you for putting the needs of others and your community above your own. So that must be acknowledged at the forefront of talking about healthcare workers in general. But I think it's important for you to also recognize that this is a marathon and not a sprint. So you need to gear up and build your own resiliency in terms of getting through a marathon and not a sprint. So it's normal to feel pressured and overwhelmed with the constant risks that you face that are quite unique to you as a healthcare worker. But also managing the feeling of that you are doing the best that you can and you are not single-handedly able to save the world. So focusing on doing the best that you can and reminding yourself that the stress that you feel is not to not being able to do your job adequately, but rather that it is a mark of the stressful times that we are in. And the healthcare system that is going to be continuously overwhelmed from this point onwards. So we talked about already resting when you can, eating healthy food, sustained energy, and staying in contact with your own support systems for your own mental health. And even though what we're experiencing is uncharted territories, it may be really helpful to identify for yourselves what have been the coping mechanisms that you have relied on in the past that have helped you through difficult times. And what can you possibly tap into in terms of those existing coping mechanisms and coping strategies that may help you to get through this particular time? Now, some of that might be helpful, and for others, it may be about developing new coping strategies. So it's important to just have that space to think about what is it that I usually do to help me in a time like this. And this is essentially what the ongoing platform that we will be creating for healthcare workers in the every Friday sessions that we are wanting to have, that it creates the space for us to have those kinds of discussions around specifically focusing on your coping strategies and what you might still find helpful in learning new coping strategies going forward. So we'll talk more about that in terms of what structure we thought might be helpful to continue that conversation. Some healthcare workers may already be experiencing distancing of their current support systems due to the fears around being exposed to risk. And this creates unnecessary challenges and related stigma. In fact, they say that the stigma and discrimination involved with COVID-19 may actually be worse and longer lasting than the actual virus itself. And we're starting to see some of this come through already in terms of healthcare workers feeling even more isolated as a result of the role that they're playing in managing this pandemic. So again, we need to be mindful of what is it that we rely on in terms of our own coping mechanisms, but also to lean on those who understand the nature of the work that you are doing, even if it is just by digital means, even if your support system is only accessible through WhatsApp calling, video calling, Zoom, whatever it might be. So talking together as a family about how you overcome some of these challenges and what it presents to your family in specific is also an opportunity to create new family experiences. To talk about the loss that they may also experience in terms of feeling robbed of family time, the change in their schedules, how everybody needs to come to the party to support one another, the sudden sort of end that your family might feel to extramural activities that you used to take part in. What is still possible in your own family structure and with your current sort of work schedule? It's important to try and keep that routine where possible, but to also talk about the changes that are required, the flexible mindset that's required from everybody in your support system, as well as the loss that they may experience with the changes that this results in. It's also useful to recognize that your colleagues are going through a similar experience to you, and they may be a great source of support during this time. So how do we tap into what your colleagues may be experiencing and creating that platform of support? Again, the Friday sessions that we'll talk about in a few minutes can also be a platform to encourage the collegial support that is available. It really is also important for the general population to acknowledge the efforts of healthcare workers during this time, and for the sacrifices that you are making to keep everybody safe in this time. Okay, so just a few ways to promote positive mental health before we sort of open up to questions. And just a reminder that you can place your questions in the question and answer or chat functionality. So the first thing is, what are we doing to review our perspective in this time at present? So do we view this time as a comma or as a full stop in our lives? And what I mean by that is, do we view this as a pause in our normal way of living, or as a complete disruption in our life, and at what may feel like the end of our lives in terms of a full stop? So again, this brings in the idea of, we are currently in a period of disruption. There's a period before the disruption, there's a period after disruption. So do we view this then as a comma to get to the period after the disruption, and how do we prepare for that adequately? How do we change our perspective with what we're dealing with now, so that we can develop the skills that we need to cope post this disruption? So it's important to see this as a different period of time in our lives, and not necessarily a bad one, even though we didn't choose it. Keeping our daily routine where possible, and being mindful of how we need to get through this time, and that our days may look very different to what we are used to. We do need to create a daily routine that prioritizes looking after yourself. So even if it is the time that you are spending driving to work, what are you doing in that time just to engage in some self-reflection time and reconnecting with ourselves? So how do we put times like that to good use? Because I'm sure once you get to work, there's not much time to consider anything else. How do we create alternative perspectives in terms of tangible coping strategies? Some people consider writing things down to be very useful, and we may want to consider writing down all the negatives that we are experiencing right now, from being an absent parent in some cases, to technology issues that you may be experiencing, to not having all the ingredients available to you in preparing a meal at home. So whatever that might be, write down all the list of negatives that you might be experiencing, but then create a list of all the positives, and a list of all the opportunities that this creates for you, the positive contribution that you are making globally in managing this pandemic. So there's a lot that can be separated out in terms of trying to gain perspective, using a very simple technique of writing down all the negatives and writing down all the positives in this particular time, because this is what helps to give us hope for the future. And when we have hope for the future, that's what contributes to a positive mental well-being. Identify the baggage that you may be carrying and anxieties that you may be transferring onto others, and the impact that this has on yourself and others, and reaching out if you need help and support at a time like this. Again, we'll talk about the Friday session that we'll create as part of the structure, to have a place to offload some of this baggage as well. The need to dispel the fear that you may have. What information do you need to do this? What support do you need to do this? This will look different for different people. I just want to make sure I'm still connected. Perfect. So we need to look at what platforms are available to us to stay connected to our loved ones. Journaling can also be a useful tool to reflect on and make visible our own patterns of behavior and areas that we may want to address at this time. And then focusing on the positives. What relaxation techniques do we need to put in place? Our opportunity to try new skills. Today you'll have a session with Baiju, who will take us through some possible techniques, so we can look forward to learning some techniques before this session is over. And what can we do to upskill ourselves at this particular time, and focusing on the positives. The last thing that I want to say before we open up to questions is to be kind to yourself. These are unprecedented times. It means that we all learning. We all don't know what is coming up. We have sort of other countries that are ahead of us in this curve, that have some sort of ideas that presented to us on what we may expect. But the truth is we don't have this figured out, and we're all learning together. We can't be everything to everyone, to our families, to the patients that require your attention. Your children also need to experience boredom from time to time and use that as fuel to be more creative and explore their own world, because we also carry guilt feelings around not being available to our children at this time. So don't put that additional pressure on yourself. Be kind to yourself. These are uncharted territories. And essentially, it's asking of us to be an explorer at this time in our lives. So with that, I'm going to end the slideshow and open up to some questions that may be coming through from our panelists today. We do have at present around 88 people that have logged on to the webinar. And there hasn't been anything coming through at this point in time on the chat.
Okay, thank you.
I'll keep an eye on the chat throughout, Vanessa. So if there's time at the end as well, then we can also answer more questions then.
Okay, sure. Thank you, Navlika. I think that was really an insightful presentation with real tips of how we can cope in this pandemic. But I think very importantly, and I want to re-echo your sentiments to the healthcare workers, that we really have these healthcare workers, all of us, whether we're at the back lines or the front lines or the sidelines, everyone is doing their bit to contribute to this massive scale of humanitarian need that's needed. You know, it's not just the care and the clinical care, it's the support, the love, the attention that you give to all these patients, to your co-workers, to the rest of the healthcare teams, who all put it together so that we can offer these services to our patients. And it's not just the COVID patients, it's all the usual patients who are visiting the facilities who still need our support and care. So big thank you to everybody on the front lines. And yeah, I think we can open the floor to some questions. I don't see, okay, there's some questions on the chat box. The first is from Atilola Adeleke. Thank you, Atilola. It's how do we deal with stigmatization even from colleagues? And The second question, yes, the slides will be available after the presentation. So I think, Navika, would you like to respond to that? How do we deal with stigmatization from our own colleagues?
Thanks, Vanessa. Thanks for that question. I mean, it really is a tough one for people to consider, that there's stigmatization from our own sort of fraternity and own colleagues during a time like this. The best way to deal with stigma across the board, whoever it might be, is through education. So the more we talk about the challenges that we are facing, the more we talk about the very real threats that this poses, and the impact that it has on us as human beings, as individuals, as family members, as healthcare workers, it starts to create more awareness to those around us, which starts to reduce the stigma. So education is the most important thing around dealing with stigma. If we cast our minds back to the time of HIV and AIDS, what a massive stigma that had. I'm not saying the stigma is gone relating to that, but it certainly has reduced over the period of time. And that is largely because of all the efforts gone into educating the general population out there, but also the healthcare workers in terms of what you're dealing with, the risks exposed to dealing with this, that is the best way to deal with the stigma related to COVID-19 in these times of crisis that we face as well. And we're hoping that creating these kinds of platforms as well allows for the realness and the challenges that we're facing as people. We all impacted by this virus. It creates the platform to talk about those challenges in a way that can possibly reduce the stigma.
Thank you, Navlika. There's another question coming through on what can be done what can be done to have everybody pulling together instead of these silos that seem to be spread across different service providers. This is from Nkosiyazi Dube. Nkosiyazi, you can actually raise your hand and be unmuted if you want to pose the question and clarify it a bit more. I'm not sure. I don't think I understand the question correctly. Is this between the different service providers for mental health services, or is it possibly within the healthcare services itself? Perhaps you can type or even raise your hand and clarify the question. Okay, I don't see any response from Nkosiyazi. I think part of this workshop and partnering with employee health services like ICAS with health services, and I can tell you there are many other institutions and bodies who are doing the same. So when this initiative started, it was just a group of concerned Gauteng health physicians who just got together and realized that we need to offer some kind of protection for healthcare workers. So besides just the usual personal protective equipment and infection control procedures at the hospitals and clinics, we realized there needed to be this mental health support. And so we asked for volunteers, and it was overwhelming, the number of volunteers in terms of counseling psychologists, social workers, doctors, nurses, etc., who are volunteering their time. So I think in a crisis like this, you're quite correct, Nkosiyazi, we cannot work in silos. I think COVID-19 has actually demonstrated that very clearly to us, that it actually equalizes the playing field. We're all in this together, across class, across race, across gender, and certainly across service provision. However, I think we all are going to grow and evolve through this and start seeing that the silos will be broken down. That's my fervent wish, but I know through panels and through partnerships like we are demonstrating today, this can be achieved. The next question here is around from Nikki Bax, how do you deal with guilt if you are not able to help due to ill health or chronic medical conditions? There's a lot of societal expectations that you would be helping. What can you do to help otherwise? Would you like to tackle that, Navlika?
Sure. So, I mean, it's a brilliant question in terms of we as human beings, we so easily feel guilt for everything that we feel that we're not doing, that we should be doing, whether it is about being a present parent at this point in time, or as you mentioned, the fact that you may not be able to be on the front line due to your own ill health or chronic medical condition. And I think, again, the last point I mentioned in terms of sort of a framework to cope at a time like this is be kind to yourself. You may be jeopardizing those around you, and certainly yourself, if you were to put yourself at risk of being in the front line, if you have pre-existing conditions as it is, and we know that those are the at-risk category for people contracting COVID-19. So you do need to be kind to yourself and know that you are doing the right thing to look after your own mental health and well-being. But at the same time, what can you do to help those so that you do feel that you're still able to positively contribute without putting yourself at risk? And you're right by saying that there is a societal expectation that all healthcare workers are in the front line at this point in time. But there's actually multiple roles that healthcare workers need to play at a time like this. Yes, we do need people on the front line, but we also need people behind the scenes supporting everything that needs to take place. So how can you possibly find yourself in that kind of role, playing that kind of supportive role without actually exposing yourself and compromising your own health? So I'll give you an example of the work that we do. We are considered essential services at this point in time, but it's not frontline. A lot of that is telephonic. We're not constantly exposed to the risk of contracting the virus by being out there with clients directly. A lot of the work we're doing is virtual at this point in time. So those are things that you could consider in terms of how could you still put your skills to good use by playing a role behind the scenes, or in alternative ways like through virtual and telephonic support that might be needed. So there definitely are creative ways that you could look at how you could provide support without putting that extra guilt on yourself.
Thanks, Navlika. There was a hand up by Alana De Bria. I think it's gone down now. All right. Thanks for that, Navlika. There's another question coming through. How would you suggest that one copes with the psychological trauma of contracting COVID-19 from one's patient? Okay, I think this is one that's, I think, obviously top of mind for every healthcare worker and creates a lot of anxiety. Navlika, I think I'm going to hand this over to you because this is really touching on trauma counseling, on touches on post-traumatic stress disorder, and all the anxieties that go around contracting COVID-19. Do you want to respond to that, Navlika?
So psychological trauma is very real in terms of, again, also the anxieties that we have, the fears that we have around contracting COVID-19. And there's only two suggestions that I have with dealing with this particular issue. Is one, you have to feel confident that you are doing everything you can to physically protect yourself from contracting COVID-19 from your patients? Are you taking all the precautionary measures that you can be taking in terms of washing your hands regularly, sanitizing regularly?
The dark side of the moon.
I think that's Clyde, who's just been unmuted, who wants to add something.
Thank you very much, guys. I was just working in the administrative side of healthcare. One of the things that is gaining a lot of traction is the telehealth approach, where telepsychology, tele-social work, the telemedicine part of life is going to become the new norm, the way I look at it. Just to comment on that.
I will touch on your question in just a minute. I'm just going to respond to the question around psychological trauma. So the first part is to ensure that you're doing everything you can to physically protect yourself. And the other part of it, from a mental health perspective, is to plan as much as you can around the eventuality of it being a reality that you may contract COVID-19. So again, despite your best efforts to protect yourself, you do face the very real risk of contracting COVID-19. And so to deal with that aspect of it, what are you doing to plan and prepare your family for where do they go? What do they need to do? Should this be a reality? And also, what are you doing to look after your own sort of health and immune system at this time, so that should you contract COVID-19, that you have the best case scenario of recovering from it, as opposed to being critically ill with the virus. So it does require a balanced approach of the physical and the psychological perspective of planning for the eventuality that it may happen. I mean, I'm sure you have all heard the stats of up to 70% of our population will contract COVID-19, if not in year 1, by year 2. So it is a very real sort of aspect that we need to deal with, and to make peace with the fact that at some point or another, we're all going to contract the virus. Okay, so the question around telehealth, I agree with you, Clyde, that it definitely is going to be, I mean, it's always been a modality that was accessible to people, not always a very popular modality to access health support, medical advice, that kind of a thing. But it certainly will be a way of the future, because many people have had to deal with that and access telehealth at this point in time. So I do think that a lot of time, energy, and effort is being invested in making it as effective as possible. There has been a load of research done already in terms of the effectiveness of certainly things like telephone counseling, virtual counseling. And in fact, some research even suggests that it's more effective than our traditional face-to-face methods. We know that telehealth methods are also more cost-effective, and it's also more effective in terms of reach. So reaching our rural areas and things like that. I think so a lot is going to be going into the space of developing that even further to ensure that we can have more positive reach. The efficacy of that is already in place in terms of successful research being done around positive outcomes from telehealth. I'm not sure if that answers your question in full, but I definitely think there is a role and a continuing role that telehealth will play going forward.
Thank you, Veronica. It does, and it's a trend that in the private healthcare sector, it is gaining significant traction. So I think going forward, it's definitely a tool to put in the box. Thank you very much.
Correct. Yeah, thanks. There's some more questions in the question and answer space. What coping mechanisms do you prescribe for your family members who are scared they may catch the infection from you? with consequent family stress. Yep, again, another very real issue that family members are are dealing with, in terms of saying, my parent or my sibling, or whoever it may be in the family, is going out there every day, and are they possibly coming home with the virus every single day? So dealing with that anxiety. Again, you have to do what you can to try and protect you and your family proactively as far as possible. So when you come home, to go directly to the bathroom, have a shower, take off your clothes, so that there's minimal contact and exposure with other family members before you can hug your children and those kinds of things from the day. And to talk about those safety measures that you're putting in place for the protection of the family. So there was a period of time that I myself was also leaving home every day, and I was the only person leaving home and coming back every day. Everybody else was already sort of confined at home. And it is a very real sort of guilt and anxiety that you come home with as well, saying, did I pick up anything? And am I putting my family at risk today? So it was simple things that you can put in place, like going straight for a shower, putting those clothes that you wore, you know, in a separate laundry basket, if it may be as well, so that it can be washed immediately or soaked immediately. And then other things like washing your hands, sanitizing the family and you once you've had a chance to obviously clean up, and then looking at those proactive measures so that people feel like they are more in control around the things that they are doing. Obviously, continuously disinfecting even groceries that come home, surfaces that it touches, things like that is all things that the family needs to talk about. These are the proactive actions that we can take together as a family to try and reduce the risk that we have of exposure within the family. There's a question around whether volunteers will be compensated if infected through UIF special fund.
Okay, on this note, it's specifically healthcare volunteers. Sorry, can you hear me? I'm just doing a check-in. All right. So there is a notice from the Compensation for Occupational Injuries and Diseases Act for COVID-specific compensation for healthcare workers. I cannot answer whether they specify volunteers in that, but I would imagine that if you are volunteering and at a healthcare setting, one could possibly apply for compensation through the COIDA funds, but I'm not absolutely sure on that. It's something we could get back to you on. But certainly for healthcare workers who are employed, there is compensation, and it probably covers their families as well. Okay, I think without further ado, shall we move on to our last and final panelist? I just want to move to the next slide, who is Ms. Baiju Dharmalingam. And we are now in the breathing zone where we're going to learn some simple techniques where we can stop, breathe, and just think about the situations that we're going to find ourselves in. So a quick introduction of Baiju. Baiju started practicing yoga in her teens, but as life happens, it gets in the way and then it shows up much later. And that's what happened with Baiju. And in that, many years later, she qualified as a yoga instructor in yin yoga, which is a style where the poses are held for longer periods of time so that you can work deeply into your body to achieve flexibility, But very importantly, I think what Baiju is going to take us through is the meditative practice to connect with yourself and to connect with your breath, which is very much in keeping with principles of mind, body, and soul connection. So without further ado, I'm going to hand over to Baiju, and thank you. Thank you, Baiju.
Thank you so much, Vanessa. I hope everyone can hear me. I have unmuted myself. And yeah, just wonderful to have me on your panel this morning. I'm very honored. But before going any further, I want to actually honor all of you health workers that are out there in the front line. I know Vanessa's done it and I know Navlika's done it, but I don't want to carry on without saying thank you to all of you for being out there and for just being such heroes in this time of crisis. So Navlika's actually put together a wonderful framework on techniques that you can use to kind of just get through this very anxious and unprecedented times that we're facing. I think for me being a yoga teacher, I've realized how important it is to be mindful of where you're at any point throughout your day, being present and being grounded to help you get through any external forces that are kind of trying to shake you up and unground you. So for me, yoga has been the answer. So just quickly, for those of you that may never have been exposed to what yoga is, it's a series of physical postures that is combined with the breath to create a movement system that connects your body with your mind through your breath. So for most of you, I'm guessing a yoga session during your workday is probably not going to be something that's going to be accessible to you. But what you can focus on is your breath. Most of us know this, but we don't remind ourselves often enough about our breath. Our breath is actually our life-giving force. But if you think about how you operate throughout most of your day, you kind of don't even think about your breath. It's there and it's helping you stay alive and it's helping you get through your day. But if it's not there, there is no more you. And so we need to actually be very aware of our breath and the incredible power that it has. So many benefits when you do mindful breathing. And that's actually the first step in living mindfully. You know, this term mindfulness is being thrown around all the time, but from understanding the power of your breath, it's the start of living mindfully every second of your day. So I know that, you know, we all anticipating, maybe we're not quite there yet in terms of the numbers with COVID-19. I'm not a medical practitioner, but I have many people that I talk to on a daily basis who are medical people. And I think just the anticipation of what's coming is enough to create a whole lot of anxiety. So there are many techniques that you can do every day on the job to help calm you down, to energize you, and to also revitalize you, because many of you are probably feeling exhausted and overwhelmed and even overworked at this point. More importantly, though, with the breath, it's not just for grounding and for calming you. If you think about it, your breath, as you breathe deeper, you can start building your lung capacity. And as you do that, you start building up your immunity. So your breathing doesn't just help with the calming, but it also helps you to build up your immunity. And that is something that I, you know, even from some of the questions that have come through a little bit earlier on, just the concern about contracting the COVID virus. If you start building your immunity, it doesn't mean that you're not going to get the virus, but it might help you to fight it off quicker. So I'm going to step back now and we're going to start talking about how you feel when you wake up in the morning. You're probably feeling relaxed. your breath feels easy, it feels smooth because you haven't started your day yet. And that's probably the time when you feel the most relaxed, just before you get out of bed every morning. And you want to try and carry that feeling with you throughout the day. And for many of you, you're probably operating in a very high stress environment, feeling anxious and overwhelmed, and your breathing is probably like kind of far in the background. So how do we go back to that relaxed feeling that we have when we just wake up, or even just before you fall off to sleep? You're anticipating this time of complete relaxation, so you start breathing a lot easier. So one of the best ways to actually do that is to do some deep, deep breathing. And what this does is it lowers your stress levels immediately, because when you start breathing deeply, it sends a signal to your brain to calm down and relax. And what that does in turn is your brain then sends a signal, the same message to your body, and immediately you start calming down. So those things that happen when you're stressed, and I'm sure most of you can relate to this, such as increased heart rate, very fast breathing, maybe even a spike in your blood pressure, will all start decreasing as you activate deep breathing. So what's nice about learning how to do some of these breathing exercises and why they're so important is because the way you breathe actually affects your whole body. And that's why breathing exercises are a good way to reduce tension and stress. The nice thing about these breathing exercises is that you can do them anywhere and anytime. So nobody even has to know that you're actually working with a breathing technique at any point in time. And there's so many different techniques that you can use. Today, I'm going to just do one to get you all started, and something that maybe you can practice over and over again, and see how it makes you feel. So what we're going to do today is just focus on a very easy breathing technique, which you can do anytime. It's a breathing technique where you inhale for a specific count, and as you exhale, you make sure that your exhale is longer than your inhale. So I think specifically for many of you, you're probably living very much in fight or flight mode most of the time. What this breathing technique will do is it will stimulate your vagus nerve, which is the part of the nervous system which will calm your body down. So it actually takes you away from that fight or flight mode, and it will actually kick in your more calm, the calmer part of your nervous system. So we're going to all do a little bit of breathing. I hope you find it beneficial to you. What I'd like you to do, maybe today we'll just practice, and then keep trying to practice this at any time in the day. See how it makes you feel. Something you can also pass on to all of those people around you, even your patients, just to calm them down. Because I think for you to be able to do your job effectively, one, you need to be calm, but you also need to find ways to calm down patients that are feeling very anxious and overwhelmed. We are in a world of complete unknown at the moment, and so the anxiety levels are obviously really high. So what I want you to do, I'm going to do it with you so you can hear me breathing, is we're going to start with 3 very nice, long, deep inhales. And then when we exhale, we're actually going to sigh the breath out through the mouth. So you're going to really allow your sigh out to be nice and big. Nobody's hopefully around you. And even if they are, they can just come and join in with you. And then we're going to work with the actual breathing technique. So let's start. Maybe close your eyes. And let's take a deep inhale through the nose. Even if your shoulders come and scrunch up towards your ears, that's okay. And exhale, sigh the breath out. We're going to take another big inhale. And exhale, sigh that breath out, just letting it all go. And last one, big inhale. And let's make this the best one yet. Sigh it all out. So now I want you to place your hands on your belly very lightly. I want you to place your left hand just above your navel and your right hand just below. So you're not pressing your hands into your belly, but you're just placing them there lightly. And I want you to just start breathing in and out through your nose. Just nice, slow breaths in through the nose and out through the nose. What I want you to be aware of is what's happening to your belly when you breathe in and what's happening to your belly when you breathe out. So the correct way for your belly to be moving is as you inhale, you want to feel your belly inflate like a balloon. So your belly comes all the way out. As you exhale, you want to feel the belly drop. And that's why we've got our hands on our navel, just to see what happens with our belly. Most of you may find that you're actually breathing in the opposite way, that as you inhale, your belly drops, and as you exhale, your belly rises. You want to make sure that your belly rises on the inhale and it drops on the exhale. So let's practice that a few times. Just finding that nice rhythm. Your belly rising as you inhale and your belly dropping as you exhale. Okay, so I'm hoping that everyone's found a nice, beautiful rhythm to their breath now. So I'm going to start adding a bit of a count to our breathing. We're going to breathe in for a count of 4, and we're going to breathe out for a count of 4. I'll do a few rounds where we breathe equally in and out, and then I'm slowly going to increase the exhale, the count of the exhale. For some of you, you might find it difficult to make your exhale too much longer than your inhale. So even if we count in for 4 and you only exhale for 5, that's okay. But you want to try and exhale to a count of 6. So just follow my counts and let's try and breathe. So we're going to start by inhaling through the nose. 1, 2, 3, 4. Exhale through the nose. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. We're going to make our exhales slightly longer than our inhales. So go with my count. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Inhale. 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Release the structured breathing and just sit here with your eyes closed for a few moments. And notice how you feel. Your heart rate has probably slowed down to a very comfortable level. Your shoulders have probably relaxed unconsciously. Even your jaw, where you hold a lot of tension and don't even realize it, is probably relaxed. Stay here for a minute or two, just enjoying this feeling of calm. And then gently open your eyes and just blink a few times. I can't hear any of you, but I'm hoping that just this simple technique and doing this breathing has helped you feel a lot calmer. I know most of you are going to rush out and start your day. So this is something you can do on the job anytime. Nobody even needs to know that you are doing this mindful breathing. Also something to do first thing in the morning, maybe during your lunch break, before you go to bed. Also helps a lot if you battle with insomnia, just to calm the nervous system down at the end of every day. And this is something you can teach your children. You can teach the older folks just to tap into their breath and this incredible power that it has. Yeah, so from my side, just a big thank you for allowing me to guide you through this breathing this morning. Hopefully I can meet with you on a more regular basis and teach you some more techniques that you can use, and you might find there's a few that work for you. There might be a few that don't work for you. Every individual is different, so I'd like you to have the opportunity to try different techniques. And thank you once again to Navrika and Vanessa for a wonderful presentation and just to raise the awareness. So stay grounded, keep breathing, and I hope to see you guys again soon. Take care and have a good weekend. Thanks so much, Vanessa.
Thank you, Baiju. I feel like I'm actually interrupting what's now become a very relaxed workshop. But
wonderful.
I trust everyone is doing well out there. I'm just going to go back to my video. All right, in the meantime, while I'm getting back to the video, Navika, you still there? Navika? Oh, thank you. All right, so the session evaluation has come up. It's just a little poll that we are doing, which would really assist us in evaluating how the session has been, whether you'd like to have this every week. Yeah, so please go ahead and complete that. I just want to, let me just start my video. Okay, so I think just the way forward, Navika and Baiju have shared with you these very important coping strategies that you could do on yourself, with your families, and certainly with your teams. One of the questions that I saw coming through, and I responded via text, was on how do we, what services rather do we offer our staff members and our team members when they are going through this major disruption and psychological distress. So one way to do this is through the weekly debriefs, which ICAS will continue to offer. That would be on a Friday from 9 to 9:30. And certainly we can incorporate more breathing techniques by Baiju at that session as well. There are hotline numbers. So when this the interventions and the partnership started just before the lockdown, these hotlines were established, and they are all working very well from what I understand. The one hotline, the WhatsApp hotline, is specifically for healthcare workers. It runs, I think, 24/7. I'm not sure about weekends, but there is an emergency line linked to that number. So you have to WhatsApp them and they call you back. The gift of the Givers hotline is for the general public, and that runs from 9 a.m. to 4 p.m. daily. Trust that those numbers will work for you. And I think on that note, we are doing well with time. If there are any more questions, we're happy to take them. Are there any questions coming from? I just want to go into the Q&A. The access to the webinars, we will through Prof. Shabir share the presentation and the recording.
Already?
Sorry, is somebody on the line? Okay. Have we answered all the questions? I think so, and I don't see any hands that are up. On that note, and if everybody has completed the poll, we'd really appreciate that before you leave. I see people are starting to leave. We know you've got to get back to work. So once again, thank you very much. As you go back to work today, we hope that you walk in strength and courage to face this COVID crisis that's upon us. And, you know, it's a whole reordering of our lives, and it's really a whole reordering of the world that's happening. So we are not alone in this. I hope you find these coping strategies and the platforms that we are offering really going to support you all through this. So all the very best. Take care out there and continue doing the marvelous angel work, as we call it, that we do day in and day out. Thank you very much. Goodbye.
Bye.
Bye. Thank you.
Thank you. Thank you very much.
Hi, Vanessa. Can I quickly ask a question?
Sure. Who is it?
Vanessa, my name is Alana, and I am a clinical facilitator at Netcare Education, Gauteng Southwest Campus. And these are very, very, very helpful. I'm so sorry that I only attended from 8:30. I only saw the email at 8:30, and then I quickly got onto the session. And the little bit that I attended was freaking amazing. So thank you so much for that. I just happened to see this email forwarded by somebody completely random, but I would love to almost, you know, I want to be almost guaranteed that I will get the link for the webinar on a weekly basis because it's so helpful. Is there any way that you can add me to your contacts or?
Sure. I think what I will do, I'm just trying to think. I think I probably will put my details on the slide presentation. I'm wondering if that's the easiest way, or do you want to send me a WhatsApp after the session?
Can I send you a WhatsApp, Vanessa?
Yes, sure. I just want to get into the private chat here. I'm not seeing your name come up.
Oh.
It should highlight you if you're talking, right? Again.
So my name is Alana Debris.
Wait, is it? Okay, all right, let me just. Can I send you a message? Hey, it's going to you and all the panelists. All right, I'll just put my number up there. Did you get it? Are you good, Ilana?
Sorry, Vanessa.
I've just said I've put it on the chat box.
I see that. Thank you.
Okay.
Vanessa, can I ask you something else? Sorry, are you limited on time or?
No, I'm fine. I'm absolutely fine.
Okay. Sorry. So Vanessa, I missed the first little bit. I just wanted to ask you. So, are you a psychologist on ICAS? I didn't get the. Sorry about that. I'm sorry. I missed the first half.
Okay, my apologies. So I'm an occupational medicine specialist, and
Okay.
I'm a lecturer at the Occupational Health Division, School of Public Health, Edwards.
Okay. Wow.
Yeah.
Vanessa,
So the psychologist on the team is Navlika. I think Navlika is still on.
Okay. I just wanted to ask you, Vanessa, so I am a clinical facilitator specifically for the trauma nurses, the nurses that are specializing in accidents and emergency. And for the past few weeks, I've been involved in a massive training project at Mill Park Hospital with regards to training nurses and paramedics on the use of the Oxylog ventilator, just getting everybody's skills on portable ventilators up to scratch, because we're obviously anticipating a huge amount of patients that are going to need ventilation. Mm-hmm. I've done numerous training sessions, and every single training session that I have been involved in, the people are so anxious and fearful, but tremendously so. And after I do my training on the Oxylog ventilator, I invariably have one or two nurses or paramedics come to me with tears in their eyes, not asking questions about the ventilator, but literally just expressing their fears on coping, on anxiety. And I just want to hear from you. I've been battling to be the soundboard of all of these fears and anxieties. Like I've sort of managed to deal with my own, but now I have like a group of people just almost emotionally vomiting on me, and I really struggle with that. I don't know if you'd be able to help me,
Right.
Just with a technique or something. I don't know.
Sure, and I think that's, Alana, I really empathize with you. I think that's a challenge that's at all the front lines right now. It's this absolute fear and terror and anxiety around the unknown. And that's how these sessions actually started, because of that, actually.
Oh no, she's cutting out.
And certainly our colleagues in the industry is around exactly that. It's that fear of the unknown. So how to deal with it? I think, I'm going to switch off my video, sorry, because I think my network just gets unstable when I use too much of video. As long as you can still hear me.
I can still hear you.
Yeah, Navlika, if you're still on, I think this is where you can, your advice comes in, and certainly the debrief sessions, I think, most applicable right now, the online debrief sessions, because you don't want to get people on site and being exposed at the healthcare facilities unnecessarily. So ICAS has been doing some amazing work around that. Is Navlika still on, or has she left the meeting?
I think she's still on because her mic is muted in the bottom left-hand corner.
But certainly there's the platform now going forward will be every Friday from 9 to 9:30, and that invitation goes out through Prof. Shabir Musa's office. So I think once you communicate with me, we can send your details onto him, and we'll take it from there.
Thank you so much, Vanessa. Can I just ask you one very last question?
Yes.
If nurses and people are not feeling safe, Are they in any position to learn? I was wondering this. I was wondering if any of my teaching is even sinking in because they're in this heavy state of anxiety, forebrain being switched off, and they're operating from the amygdala. Are they even in any state to learn?
Yeah, that's a very good question. Possibly, you know, in situations like that is where a deep breathing relaxation should happen at the start of the meeting.
I'm with you.
I think we all have to be innovative around this. I think that's what the situation calls for. You know, it's uncharted territories. And I think platforms like this help us to share these techniques. You know, next week, I'm hoping people come back and say they tried this or they tried that or this is not working. And you know what, here's a whole new idea which we never thought. And, you know, you'll be amazed that if you just pitch this to the teams you are working with, you'll be amazed at the kind of solutions and innovations that might come from them. So I think, you know, to be honest and open, to have the platform and the fact that you are, you know, you or yourself as the trainer are aware of these anxieties, I think that's a huge step in the right direction. There are some teams who are working with co-workers who are totally oblivious to all these anxieties going on, and that just adds unnecessary stress to the whole situation.
Yeah.
So I think in your case, the positives are that you as a trainer, you're open-minded, you're honest, and the platform is there for them to vent, you know, whether it's a 5 minutes before and a 5 minutes after. But I think that's how the workplaces have become now.
Okay.
Certainly, there's a project I'm working on, and we all thought it would be impossible to wake up at 6:30 every morning just to check in on each other, but we're actually getting to do it. And, you know, it's a quick check-in, how you're doing, it's just 4 or 5 of us. And, you know, and the rest of the day you get on with it. So, and we have to use, you know, technology to help us through that as well.
That's very helpful.
Yeah, so, but thank you for that question. I hope the others who are still on have benefited from the discussion as well. The session is due to end at 9:30, so we've done really well on time. For those that are still with us, I see there's about 26 still with us. Thank you, everybody. If there are any more questions I could help with.
Sorry, Vanessa, this session is recorded, so I can go back and look at the first half that I've missed.
Yeah, absolutely. Okay, I think that's it.
Thank
yeah.
you.
I don't think there's any more questions on the chat as well. Thank you very much. Have a wonderful day ahead. Thank you. Bye now.